In the labor delivery, the only indication that a woman is in the second stage of labor is a fully dilated cervix. The only way to know for sure that the cervix is fully dilated is to perform a vaginal examination, but keep in mind that frequent vaginal checks can lead to an infection. If possible, avoid performing vaginal exams often, at intervals of less than 4 hours, unless first the fetal heart rate is higher than usual when you measure it. It usually is above 120 to 160 beats per minute. Second is if there is an abrupt burst of amniotic fluid, which could be a sign that a placental or a cord prolapse is possible. Third is that before the next planned vaginal exam, you notice that the onset of the second stage of labor is starting. The mother is most likely in the second stage of labor if she exhibits two or more of these symptoms. One is if she has an overwhelming impulse to push. Second, there is during contraction she can stifle her breath or groan. Third is when she begins to perspire. Fourth is when her attitude shifts, she can get drowsy and become more concentrated. Fifth is that when she is in her contractions, her anus or external genitalia start to protrude. Sixth, when she senses that the baby's head is moving inside the uterus. And lastly is when the mother's buttocks expanded apart from the pressure of the baby's head, forming a purple line between them. During contractions in the second stage, when the baby is high in the vagina, you may see the mother's genitals swell. Her anus might slightly open. She relaxes between contractions. The baby descends further with each contraction and each push from the mother. When the mother's uterus is relaxed in between contractions, the baby is slightly pulled back up, but not as far as it was before the contraction. After some time, you can start to observe a small portion of the baby's head descending the vaginal wall during contractions. Like an ocean tide, the baby travels in and out, yet gets closer to giving birth each time. The fetal head makes the vaginal hole as big as her hand's palm. The baby's head will remain at the vaginal opening even between contractions when it has enlarged to around the size of your hand's palm. It's known as crowning. The rest of the body typically comes out with one or two or more pushes after the head is out. Verify the infant's heartbeat. Because the heart is often lower in the mother's belly during the second trimester, it is more difficult to hear the baby's heartbeat. In between contractions, if you are skilled, you might be able to hear the baby's heartbeat. In the mother's belly, close to the pubic bone, is when you can hear at its finest. The baby will push you out of the mother's body once the cervix has fully dilated. Watch how quickly each birth happens. Take the mother to the hospital if the birth is taking too long. One of the most crucial things you can do is to avoid significant issues or even the death of a woman in labor. Thoroughly wash your hands. Put on steel gloves and other protective gear. Clean drapes or clothes should be placed over the mother's thighs, and perineal area should be cleaned with antiseptic. Firmly place one hand on the perineum, the skin between the opening of the vagina and the anus. This hand will help the baby emerge more easily by keeping the baby's chin close to its chest. Cover the mother's anus with a piece of cloth or gauze. The baby's head may push some stool. To maintain the infant's head flexible, use your other hand to gently press down on top of the infant. Once the head has crowned, the face extends to the perineum where it gives birth to the head. Clean the infant's mouth and nose. You might need to assist the infant in breathing by cleaning its mouth and nose after the head is born and before the remainder of the body emerges. Use a clean cloth that has been wrapped around your finger to gently wipe the baby's mouth or nose if it has any mucus or water in it. The infant should be placed on the mother's belly, dried with a clean cloth, and then covered with a fresh, clean blanket to keep warm. Make sure a cap or blanket is covering the baby's top of the head. Give the infant the opportunity to nurse right immediately if everything seems to be in order. You don't need to hold off until the placenta is removed or the cord is severed. Most of the time, there is no rush to immediately cut the cord because some of the placenta's blood flows along the cord and into the infant. Leaving the cord linked will assist the baby have enough iron in his or her blood. Additionally, it will keep the infant in the mother's tummy, which is ideal location at this time. Wait until the cord stops beating and seems to be mostly blood-free. To tightly tie or clamp the cord, place it with two finger widths with the infant's tummy using sterile string or a clamp. Put another sterile string or clamp one finger from the first knot. The danger of tetanus for the newborn increases when the cord is severed from the body. The cable on the mother's side should be clamped. A double knot on the rope lowers the possibility of bleeding. First tie should be cut around 3 centimeters from the baby's abdomen, and the second tie should be cut about 5 centimeters from the first. Use a sterile razor blade or sterile scissors to cut after the 5 centimeter knot. Clinic delivery and cord care. To keep the mother and infant from contracting an infection after delivery, hygiene principles are crucial in the home and in postpartum care, which are: first is wash your hands. Second is to clean the mother's genital area. Third is that nothing improper has been inserted vaginally. There is a clean delivery area. Cleanliness in the cutting and clamping of cords. And last is to inspect the infant. The majority of newborns are alert and healthy. Other infants begin more slowly, but once the first several minutes pass, they breathe and move more easily, gain strength, and lose some of their blue color. After delivery, stimulate the infant while drying and open the airways, warmth, and closeness. The danger of a newborn baby becoming extremely chilly is enhanced. Keep the mother and child skin to skin while they are both wrapped in a fresh, dry blanket. The mother's body will keep the baby warm, and the smell of the mother's milk will urge him or her to suck. Thus, this should be done right away after the birth, even before you cut the cord. Be kind to a newborn child. The mother and child should not be separated within the first hour because it is better for them to be together. Additionally, spending time together will encourage breastfeeding as soon as feasible.